Awesome. All right, we are 2 minutes in. I anticipate that folks will join kind of as we go through this. And we're going to record this so that we can share it afterward as well. This will be a fairly quick session. Our goal is to share wonderful tips around sleep with all of you. But before we do, I want to introduce myself and Leva and welcome you to this wonderful webinar. So I'm Vanessa. I am the founder of Leva, and our whole platform is about supporting new parents on their journey holistically. So if you're pregnant or postpartum, we help you with everything from mental health to lactation support and feeding to nutrition and sleep, as you'll see today. So welcome, thank you again. And I'm going to hand it over to Nicole, who is our pediatric sleep consultant and specialist. But the wonderful work that she does goes far beyond that as well, which you'll get a sense of as we go through this presentation today. And then we will also make the recording available to everyone on this call and your leadership teams so they can distribute it as they see fit. All right, without further ado, Nicole, take it away.
Thank you, Vanessa. Hi, everyone. I am Nicole. I am a newborn care specialist, postpartum doula, and pediatric sleep expert. I work with families and ages newborn to 12 years old on sleep, nutrition, behavior, you name it. We're here to help holistically with, pregnant moms and moms just having their baby, moms who are already established with multiples, twins, triplets, you name it. We help all ages, and we don't limit ourselves to guiding moms and dads to help with anything newborn, sleep assessments, bedroom assessments. We guide you to prepare for your baby's journey. So today I would like to talk about sleep solutions for parents. As we mentioned, this is for everyone as a whole. So when we're working with families, it's not just affecting the children, it's affecting the parents. A lot of times they're working parents, and if the baby and child aren't sleeping, then you aren't either, right? So we like to make sure everyone is getting the rest they need, especially after having a baby in the postpartum period. It's very, very important for mom to get that rest and, so she can recover and help with baby. The importance of sleep for everyone's well-being and child development, it does impact the mental health. A lot of times postpartum depression happens because a mom will come to us and say, my baby is not sleeping, they're crying all day, please, I need help, I need to rest, I need the sleep. If you're up all night for 8 to 10 hours every 10 minutes, it's just way too much. You're not getting the rest and support that's needed, right? So it's going to affect your mental health. And with Leva's holistic approach, we do guide you to have a structured schedule, and therefore you're able to get the rest that you need. The common sleep challenges for working parents, a lot of times it is the irregular schedule, stress from coming home from work and having to deal with a child who's not sleeping overnight or even not eating their dinner fully. It does take a toll on the family because they're bringing all that stress home, and then now they're having to deal with something else, right? Like you're not able to focus on family time because things are just all over the place. A lot of times when the children have a structured schedule throughout the day, it helps them as well to, okay, no, now we're having dinner time. Now it's time for settling down, with their bath, brushing teeth, and starting their bedtime routine. So we do like to help with a structured schedule, not just for babies, but for older children. Because it does help with anxiety as well. They also go to school, parents go to work, the child goes to school, and everyone comes home, and there might be anxiety from work or school or whatever happens during the day. So we all want to treat that as a whole for the family and to just help guide everyone for less stress. Why children wake up at different ages. So over here we have the newborn stage where although we don't sleep train yet until the child is 4 months old, we do help with sleep routines to teach your baby that, once they reach 4 months, we are now introducing them more to a structured schedule, although all of my techniques and methods are gentle methods. We do like to introduce more of the sunlight to them. Now their circadian rhythm has kicked in and they're not just sleeping anytime and feeding anytime. Usually by 3 months, they're starting to feed more during the day. That way they can sleep more at night, but with a couple feedings still, because at this age, they're so little and they do need to feed still as much as they need, just not as much as a 1-month-old baby. And then infants and toddlers, we have from 4 months to 2 years. Some stories that we hear are we've never had a sleep schedule, they were never sleep trained, or they slept with us in the same bed. That's another thing that, parents need help with because they are sleeping with them in the bed and we need to transition them into their own bedroom. We do help with room sharing, just in another bed for safety, in a crib or bassinet. Preschoolers, 3 to 5 years old, again, they tend to still, wake up a lot overnight. That's when they drop naps. So we do help putting them to bed earlier. Sometimes when they're going to sleep later, it causes a lot of wakes overnight. So we do help with that, shifting bedtime earlier. Ages 6 to 12 years old, they are older, but this is where their anxiety kicks in from school or things that go on during the day. The melatonin levels are a little bit off, so we do help them with a sleep school program to where we meet with them weekly, also not just the support with the families. And with that, it's longer because they are older and we're shifting the anxiety and the stress levels, and they're not taking naps at all during the day. They are going to bed later. So we do help with all scenarios. I do want to talk about a toddler success story that I've had. I've had many, but I had a mom who had a 12-month-old baby, and she was not sleeping great. She was on the verge of tears, and this mom was talking about the baby waking every 10 minutes. And for a 12-month-old, by then we do want them sleeping through the night, of course, and that's when all the feedings overnight we should be done by 9 or 10 months old, depending on if they have a calorie deficiency. Every child is different, and we do treat our support with these families formulated. We structure it to be tailored to your family, your baby. Every child is going to be different. We don't have cookie cutter templates where we hand you a template and tell you, here's a schedule. We work with you one-on-one. So with this mom, we adjusted the feedings overnight. There was no calorie deficiency. The baby just was used to mom feeding her like multiple times overnight. So we did adjust that. We weaned her off and gave all the feedings throughout the day with, her meal times, milk feeds, and just making sure that her naps were aligning throughout the day. And so she was taking full naps during the day now and sleeping through the night. She did have one wake, which is okay because a lot of times parents think sleeping through the night is not waking at all. As adults, we sometimes still wake overnight, to use the restroom or grab a glass of water. So for them, they will have interruptions overnight, and that's okay. And that's where we use our gentle methods to help them connect their sleep cycles and put them back to bed. So she did have a successful story at the end of our journey together and one-on-one support. Improving sleep practices for parents. We always recommend establishing a consistent routine. As I mentioned earlier, um, when there's structure and a schedule and children know what's happening next, it does help them throughout the day, staying consistent, and also creating a relaxing bedtime routine, whatever you want it to be. If you want to read, bath, have a milk feed in another room, and then going to the nursery, we work all around it. Everyone has a different routine with their child, with their baby, and avoiding screen time. I always tell my parents to avoid screen time 2 hours before bed, not just for the child, but for the parents as well. Just relax, maybe do a family yoga session that does help our older kiddos. And when the parents are doing it with them, they tell me we're all feeling relaxed. And, then they'll read a book just to wind down and, from a long day, and just calm before bed. Encourage daytime physical activity, establishing a consistent sleep schedule. All of those, help children settle down before bed. Sometimes we do have to wake them from nap. Who wants to wake their baby from, sleeping at nap time? But sometimes we do, especially for the older ages. They can't have too much daytime sleep, and we don't want them to be under tired as well, because that will affect bedtime. And sometimes I will tell parents, okay, don't let your 10-month-old sleep longer than an hour and a half to 2 hours at a time for each nap. And then we will cut that nap. That way we can save it for the next nap and save bedtime sleep pressure, because they do need to build sleep pressure in order to sleep at night, or they're going to be wired and they won't sleep for you. I do want to talk about a school age success story. I was working with a 7-year-old child, lots of anxiety, bedtime anxiety, thinking about going to sleep was something extreme for this child, screaming, crying. We did a gentle approach. I worked with him, and things shifted. We did shift bedtime earlier, because, as I mentioned, every child is different. And sometimes parents think, well, if I put them down later for bedtime, they're going to sleep all night. But really, if they're not napping anymore, especially for a 7-year-old, sometimes they do need to sleep between 7 and 8 still, not 9 or 10 p.m. So when I do work with these families, I dig in deeper and say, okay, what's the cause of, him or her waking a lot overnight? What time did they go to bed? What are they doing before bed, right? Are they watching TV right before bed? Are they having their dinner super late and then they're just jumping into bedtime? Like, we do need them to wind down slowly, and just it will help with the anxiety as well, because if they're going into a calm routine, they don't feel like, okay, my mom and dad are going to leave me and now leave the room. So we do let parents stay in the room. We'll do activities with them. I have a ticket system, and just a chart system as well, some homework for the child, to work with, gradually. That way we're not treating it as like it is a sleep school, right? Because then that will give them anxiety. And I'm here to remove that stress, not add more to it. And then they were finally going to sleep earlier. Little by little, we adjusted 10 minutes every night to have them go to sleep earlier. Working together one-on-one helped a lot, because having a third party other than mom and dad working one-on-one with him, it did help a lot. And just doing meditation and yoga before bed, having red light therapy in the room on his sound machine, because they still use the sound machine even at 7 years old, because it does block out any sounds. And sometimes when the child has anxiety, blocking out, like, a car outside or the air condition coming on, it does scare them a little bit. So it helps when we have that sound machine going. I love this one. Why I don't use cry it out. A lot of times parents may think sleep training, sleep conditioning, sleep teaching, all of that is Cry It Out. I do not use Cry It Out because it does not always work. A lot of times parents will come to me and say, I use Cry It Out. I let him or her cry for 2 hours and it didn't work. I need help. So it helps when we have an actual method going, a step-by-step approach. We walk you through the whole thing with our sleep plans. Um, and for certain ages, it you need to stay in the room with them, right? Sometimes we need to use gradual approaches where we're associating with the child, the association faded method, or a lot of parents know it as the chair method. We do like to put a twist to things and use hybrid of both time checks and the chair method. That way you're in the room, but then you're also leaving the room and coming back. So it just depends on what age we're working with, and exactly what we're doing, because if we're just letting them cry it out and they're not like, let's say a 2-year-old and they're just crying all night, they're not gaining your trust. We're not helping them with their sleep cycles and helping them connect it, because again, we're here to help and teach you and your child how to help them get back to bed. And then once we shift those naps and bedtime, and we also incorporate those gentle methods, it all comes together like a puzzle and everyone is sleeping much better. How Leva can help. We will help you with one-on-one sleep coaching, tailored plans. As I mentioned, it is support for all ages. We don't put a limit between newborn, even though they can't sleep train yet, but we help with conditioning, routines, helping you learn how to swaddle your baby, what pacifiers to use, what bottles to use. If you're having trouble with lactation and milk feeds, we have lactation specialists on board with us as well, and when you should be feeding your baby. We don't want you to have that stress of what to do next, right? So we're here to help you throughout the whole journey, whether it's anything to do with sleep, nutrition, behavior. We are here to help your family as a whole and get you and your children sleeping through the night. And here is Leva's support contact information. We have the email and phone number, and I will now let Vanessa take over.
Thank you,
Thank you so
Nicole.
much. You're
Thank you.
welcome.
No, thank you so much. This was amazing. And I love the success stories you shared. I have a 7-year-old, and some of what you mentioned, I'm going to try it because there are moments
Yeah,
that he has a hard time going to sleep and winding down. And I think
for sure.
the screen time tip and the yoga and meditation tips would make all of our lives better. So I'm very
Yes.
excited about that. Um,
Yeah, and you can do it with him too.
yeah, I should. Make us all much more zen. Okay, I would love to take the last few minutes to answer any questions. Obviously, Nicole is the expert, so she'll be answering the questions. But if you do have a question, right now is the time to think about it. I will, you're welcome to unmute yourself to ask or put it in the chat. Or if you'd like to stay anonymous, you can message it just to me and I will read it out loud. I did get one question ahead of the call, so I will just read that story now. So the writer says, I have a 5-year-old and a 2.5-year-old. We have just transitioned from the crib to the big boy bed. We bought a full size so that we can lay with him to sleep. For the last 3 months, he's been waking up 3 to 5 times per night. He's been
Yeah.
hanging over the crib rails. It was getting so old. So sometimes we bring him into our bed. Now that we have this solution, it was the first night, last night was the first night he slept in his big bed the whole night, but he did wake up a couple of times and we would go and lay with him to go back to sleep. We're making progress, but we are also exhausted. I hope we're on the right track. Do you have any advice?
Yeah, so for sure it is, when parents are transitioning their baby from crib to bed, it is a challenge. And this is not something that is going to be a quick fix, or, something even in a 1 week process. That going from a crib where he's been sleeping all the time in to now a floor toddler bed where he could just easily get up, it is a challenge, but they are off to a great start. This is an awesome time to introduce it, especially if now he knows how to climb down and off the railings. We always want to practice safe sleep, so that they're on a really good start. But I do recommend doing a ticket system with him, or a chart, to where you're giving him the wins of staying in his toddler bed. And even if he does get up out of the bed, let's try to stay in the room, right? Just to talk to him about it. And his age is appropriate for them to have family meetings, maybe at dinner time. Just talk to him and say, hey, like tonight we're going to go to sleep. Mom and dad are going to go to their bed. We'll stay with you in the room. But then I want you to try to sleep on your own with a lovey or a stuffy, or maybe mom's favorite shirt. So those do help as well. Just talking to him, and letting him know what's going to happen overnight. Like, mom's going to go to sleep, dad's going to go to sleep, and they just want that trust to be built. Like, okay, mom's going to come back and check on me, and even maybe put a monitor in the room still, just to see what he's doing when he goes back to bed. Monitors aren't just for babies. We still use them, even when they're school ages, just to check on them.
That is awesome. Thank you, Nicole, very
You're
much for the
welcome.
advice. All right. Anybody that's on the call have any questions with our wonderful expert here? You can get some real-time feedback. Oh, I see some coming in. Okay, great. Thank you. Julie says, when starting to sleep train a 6-month-old, is there a certain time frame length you aim for in regards to how long it might take to get them transitioned?
Yes. So 6 month, they are going through a regression. They're learning so many things, right? Sitting up on their own, crawling. Sometimes they're able to transition easily, to where if you are putting them for their naps at the proper timings, and then bedtime routine, and bedtime starts at a certain time and an appropriate time, it will be a much quicker experience than for you to hold off and keep waiting. It might take longer for naps to align, because sometimes bedtime is easier than the nap timings, because we want them to align and be at specific timings. Let's say your baby is sleeping at like 10 a.m., right? And they're supposed to sleep at 9:30. Once we adjust the proper timings, and again, I'm just using this as an example. I would have to dig deeper. What times they're taking their naps? Are they still taking 2 naps and a cat nap? Are they just down to 2? Every baby is different. So definitely it all depends on the consistency and the times that we're shifting and changing those naps to be. And sometimes if they're in daycare, they're not taking a full nap because they are sleeping in one room with a whole bunch of other babies. And then they do have to go to bed much earlier because they missed their naps during the day. So it's always, there's a lot of leverage there. And it's not, sleep training is not strict. You can always switch up, a nap. If one got missed, we just give more minutes for the second nap. Or if the second nap wasn't so great, we just up bedtime. So there is a lot of, flexibility with sleep training.
That is awesome. Thank you. Also, I'll just add, I know that recently Nicole was coaching one of the parents through through Leva, and it was a few different sessions that she had with this mom. And their baby was going through some issues with daycare because of the time of the naps, but they worked on it together and things improved dramatically. So there's always a path. It's a good place to be. All right. So Nick has a question. I have an 18-month-old who seems to only sleep about 9 hours at night and a 1 or 2 hour nap during the day. Is that enough? He used to sleep longer. He sleeps well. We just feel like he gets up pretty early. He has a regular schedule, 8 p.m. to 5 or 6 a.m.
Okay. So yes, 8 p.m. is late. Remember, when they're going to bed later, it does cause multiple wake ups overnight, and 5 a.m. is pretty early. So we would treat that wake up as an overnight wake, and then getting him back to bed, because the appropriate time is between I would say 6:15 to 7 a.m. So anytime they wake up earlier than the appropriate time frame, you would want to treat that as an overnight wake. And then you definitely want to shift that 8 p.m. bedtime earlier. For his age, he's not gonna sleep longer for naps. He should be taking between 2 to 3 hours. If he's going down easily for bedtime, then 3 hours is okay, and we don't have to cap naps. But if he's giving you a hard time, then we do need to take off some of the nap times during the day so he can build enough sleep pressure to sleep for you at night.
Fantastic. We got a few minutes left. So if anyone has any more questions, feel free to put them in the chat. If you haven't explored the consultant section of the Leva app, you'll find Nicole there. It's on the bottom bar. It has a little heart and hands. So you can book time with her directly through the app. I think most of you have that covered through your company. If not, feel free to reach out and we will work with you. But happy to make any connections you need. Not seeing any other questions come through. I'll give it another minute, but thank you otherwise so much for being here. Nicole, thank you so much for sharing your
Thank
awesome
you.
expertise. This was really great.
Thank you so much for having me here today, Vanessa, and I hope to help all of you with your children's sleep.
All right. Have a wonderful day, everybody.
Thank
Get some good
you. You
sleep.
too. Bye.